So there are two parts to our program. One is what we call our brick and mortar program, and that is the Barrow Concussion and Brain Injury Center, which actually is a multi-disciplinary program that includes neurology, neuropsychology, neuropsychiatry, as well as a social worker and a team of therapists, physical, occupational, and speech. Then there is our community program, which is the Barrow Concussion Network. This program works with athletic trainers throughout Arizona and now in California to provide concussion care to all of our state athletes, specifically our high school ones. We utilize ImPACT baseline and post-injury testing, as well as a telemedicine program to communicate with our athletic trainers. The Barrow Concussion and Brain Injury Center has been in operation since 2009. The Barrow Concussion Network, which actually started with Barrow BrainBook, was in 2011. We implemented our statewide ImPACT testing the following year in 2012, which is also when we started our telemedicine program. Our key program is what is called Barrow BrainBook. This started with a need, of course, at the high school level. The Arizona Interscholastic Association approached the Arizona Cardinals, recognizing that the issues of concussion at the professional, subsequent college were going to reach the high school level. As a partner member of both organizations, they asked us to come up with a solution. And as a former special education teacher, my solution, of course, was education. Now, they first said, well, all right, we'll buy you a van, you can go from school to school and educate kids about concussion, but obviously that wasn't very practical. So instead, what we did is reach back to my alma mater at Arizona State University into the Educational Technology program. With them, we created the first concussion education program for whom this matters most, and that is the high school athlete. There was education prior for coaches, for parents, and healthcare providers, but this was the first one for the athlete. It is called Barrow BrainBook. It focuses on a few elements of concussion, including identifying and defining a concussion, knowing the signs and symptoms, what to do, and who to tell after an injury occurs. We feel that empowering the athlete is most important to recognizing the health issues that they have and taking a responsibility and care for reporting them, as well as being a part of the recovery. And so educating the athlete is key for us. High school is where we see most of our players. However, there are also youth players. And for them, we've created a concussion education video game called Barrow Brainball. And so once again, putting the hands and the information in the hands of those whom it matters most, which is the athlete. Even today, we still see a lot of parents and non-professionals feel that a concussion occurs only when somebody is knocked unconscious, when in fact less than 9% of the cases of concussion, especially at the high school and youth level, occur in the presence of a loss of consciousness. Additionally, what we see is that many parents and non-professionals fail to recognize the emotional changes that occur with a concussion. Even at the professional levels, we assume that an emotional response is something of despair, when in fact it is the brain's response to an injury, and it may not be voluntary. This could include crying uncontrollably on the sidelines. This could include having irritability and mood swings after a concussion. So it's very important that our families recognize that this indeed is a sign of a concussion. It can be difficult, especially in the adolescent population, when there is a lot more depression and anxiety. But at the same time, because concussion can make things worse, we tend to see worsening of underlying anxiety, worsening of underlying depression. And unfortunately, in our society, psychiatric disease and psychiatric change is very taboo. But it is critically important to recognize this and, when necessary, treat it appropriately. When it comes to changes in the way that we approach concussion, we need to make sure that we collaborate more. And that is an athletic trainer collaborating with teachers, with school nurses, and with coaches. In part because what we've done is we've taken the coach out of the equation because we don't want to make them have them make medical decisions. We do, however, want them to be involved in recognizing how important health is in their athletes. We want them to really emphasize that their athletes are better off playing healthy rather than injured. And so what that means is after an athlete has sustained a concussion, that they are encouraged to get the help they need so that when they do come back, they are as healthy as possible and can make a strong contribution to the team. Sometimes it's not always apparent that a concussion has occurred. One of the key factors in asking a patient, an athlete, or somebody who may have sustained a concussion is, tell me exactly what happened. If there's a gap in memory, even though they may not have been knocked unconscious, then that's a pretty strong sign that indeed a concussion occurred. And then you ask, what are some of the things that you're feeling? Dizziness, headaches, mood changes is really a big issue that's not always recognized, and some of the thinking changes. And so when you have a full spectrum of understanding of what the brain does and how that can change as a result of a concussion, then you can better approach athletes, especially youth, after such an injury. We've really moved away from scare tactics when it comes to concussion and towards empowerment. By that I mean, when we're talking about concussions, we used to say, danger, 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 you're going to have hemorrhage of your brain, bleeding of your brain, and indeed, that is still important to convey as a part of the message. However, we are now focusing on how important it is to play healthy, whether it's to you, to your teammate, not just for this game, the following game, the state championships, and year after year. And so we really are trying to adjust that message so it is empowering and it is a positive message about playing healthy, including when someone has a concussion. We've been really pleased since we've been educating our youth. They are now more aware of it than the parents. They are now identifying concussion in themselves and in their teammates, and telling an athletic trainer, telling a coach that so-and-so isn't right, they should be checked out. And of course, when in doubt, sit them out is the mantra, making sure that they are removed from further harm in play. Baseline testing, whether it's baseline cognitive testing, baseline balance testing, baseline vision testing, can be very helpful when done properly. And this is really critical. When you're administering a test such as ImPACT, you want to make sure that that baseline is a valid baseline. You want to make sure that it's done properly, administered properly with the proper student in the seat, and it gets done right, because otherwise, on the back end, if you have a post-injury test for an athlete that has, say, an invalid test or there's something clearly wrong, then you really might not know what to do. And moreover, you actually might be at greater risk by doing a post-injury test in something that has not been done properly. It helps with some of the decision-making. It is a tool to be used in conjunction with a physical exam, in conjunction with symptoms testing, making sure that the athlete has appropriately returned to school before making that decision that it is safe for the athlete to return to play. Technology has done wonderfully for our youth population, especially allowing them to have access to tools that were inaccessible in the past. We know that the gold standard for cognitive testing is the neuropsychology evaluation. However, there simply aren't enough neuropsychologists available to perform these types of tests. Additionally, paper and pencil testing is intensive. Computerized testing provides that opportunity for athletes to take a test in small groups that can be proctored by someone like an athletic trainer in order to test things like thinking and memory. Such technology has also allowed us to perform things like sideline coverage. I have the privilege to serve on the sidelines of the National Football League, as well as Division I NCAA play at Arizona State University. However, once again, there are not enough neurologists for high school sidelines. So what we've done is we are using technology, specifically smartphones that have accessibility to video conferencing, so that we can be on the sidelines of a high school football game. We can be in the locker room after an injury. We can be in the athletic training room and provide this service to those who need it most. It is most important to have a healthcare provider on the sidelines, such as an athletic trainer. However, we want to make sure that somebody like an athletic trainer has access to concussion specialists. And so technology allows those athletic trainers to have access to those specialists anywhere throughout the state. So telemedicine, in many ways, people think of telemedicine as hardware-based, meaning you have to have a special screen, a special camera, specialized equipment in order to communicate the issues associated with an athlete or a patient in a rural area. The nice thing is now we are focused on software-based technologies where somebody who is requesting a consult can do so with their own mobile device using HIPAA-compliant or health privacy information compliant software that allows them to communicate with a specialist. And it doesn't just have to be for our rural communities. It can be in our urban underserved communities or even our suburban communities. It allows them to communicate freely and quickly. It allows us to have a specialized perspective and consultation that they would not otherwise have access to. It's critically important that everybody be on the same page when it comes to concussion management, treatment, and diagnosis. As research has evolved, there are a number of things that are changing. When I was playing football, we got a swat on the butt after we had a head injury and went right back into the game, and we know that was wrong. The pendulum has swung the other way such that now we're seeing a number of athletes that after a concussion they're put into a cold, dark room and told to come out when they're better. Such cocoon therapy or strict rest we also know can be detrimental. Fortunately, not deadly, but it can be detrimental to athletes, especially for their mental health. They get anxious, they get depressed, and we also know that physical activity can be beneficial after a concussion. Still avoiding another head injury, but it also can be beneficial. When we see athletic trainers, coaches, and physicians on the same page, we see that athletes have the best resources available to them. One of the advantages that we have with our telemedicine program is that our athletic trainers know exactly what to expect when we are providing a consultation. They know that we are going to be on the conservative side when we're looking for resolution of symptoms at rest and with activity. They know that we are going to stand behind them when there's a dispute of whether or not it's safe to return an athlete, erring once again on the side of caution. We also know that when we see the athlete, should we need to see them in the clinic, that the communication we have is going to be the same communication they provide when they're on the sidelines. When it comes to a sideline evaluation, whether it is at a high school, college, or professional level, what I often see as a big mistake is rushing the process. It can be a challenge, admittedly. You can get caught up in the moment. However, it's important to remember that whether it is high school, college, or professional, that this is somebody's child, that this is somebody's sibling, and in some cases maybe somebody's parent, and you have to focus on what is most important for the health of that particular athlete at that moment. And even if you're unsure of yourself, because the mantra is, when in doubt, sit them out, you know that's the best thing for the athlete. And ultimately, if the diagnosis is something else other than concussion, that's okay. Because if there was a concussion, you may have put them into harm's way and have a significant negative outcome. When it comes to the use of ImPACT, what we were able to do in the state of Arizona is to provide this resource to all of the state's athletic trainers. What's critically important is they are trained to administer ImPACT, whether we train them or they get the training ImPACT directly. This is critically important because we will not release the license to them until they've done so. Once they've done so, we can feel more confident that they're going to administer this properly, and we actually will check up with athletic trainers throughout the state to make sure they've done so. It is part of the program for baseline and post-injury testing. It is part of our educational module such as Barrow Brain Book. It is part of our consultation service that we use for telemedicine. This allows an athletic trainer to provide the baseline testing, and in the event of an injury, they will provide their physical exam and assessment of the athlete. They will provide the baseline and post-injury test so that we can make a remote assessment and determine whether or not that athlete can return to play, come into the clinic, or needs further rest or rehabilitation. When it comes to an athlete that does not have a baseline test, we want to have a strong understanding of what that athlete was like before. For those that have a learning disability, for those who have attention deficit hyperactivity disorder, or any other neurological disorder that may affect their participation in the test, we want to really understand what that athlete's going to look like afterwards. So if any of those things are present, then it's really hard to use ImPACT as a post-injury only. For those that do not, for those that fall into the mainstream in terms of their neurological development, in terms of their academic performance, then indeed we can make a comparison to the general population. However, just as we use this tool in the setting of those who do have a baseline, it is only part of the puzzle. We still have to make sure that we have a strong understanding of the symptoms at rest and with activity, and that we have a strong understanding of their physical exam at the time that we are considering returning them back to activity. In addition to providing some guidance as to when an athlete might be able to return to physical activity, it can also be very helpful to get an understanding of what the deficits might be at the time. For example, because we want to focus on what matters most, and that is as a student, before being an athlete, we want to make sure that they are academically successful in school. And knowing where the deficits may lie in, say, verbal memory or visual memory, we can provide some recommendations to the parents and or teachers about how they can help them through their academic environment after an injury. Data is incredibly important. However, we have to make sure that it is good data. So just as we want to make sure that a baseline is valid and that the baselines are quality, we want to make sure that the data that we get out of a population is also of high quality. By having this in research protocols, we can ensure that it is cleaner data, if you will, than just gathering this information from the general population. So looking at the quality of the data is incredibly important. But once you have that data, we can have a better sense of the recovery rates. We can have a better sense of different specialized populations of athletes after their injury. In my opinion, some of the most valuable features of ImPACT are its accessibility to athletes. The fact that it is available remotely, the fact that there is an emphasis on proctoring for administration and for post-injury testing, the fact that it does require an interpretation instead of an automated interpretation, I think is important for those who know the test. The other thing is it's been around for a very long time. And as a result, it's undergone a lot of testing. There are a number of publications about it. So we know the good, the bad, and the ugly about the test and can really utilize it properly as a tool to make some decisions. As an FDA-approved technology, we know that there are additional steps and standards that the tool had to undergo in order to receive that certification. It is important, in addition to the fact that it has undergone so many years of analysis and peer-reviewed publications, that we know the qualities of the product. Data privacy is of the utmost importance. We live in a world in which there is hacking that occurs on a regular basis to multiple institutions. We know that health information is important, that it should remain private, and so the encryption that occurs on a tool such as ImPACT is very important. When it comes to customer service, it's critically important to have multiple layers of customer service, whether that is reaching out to somebody for a technical question, for access, for something as simple as a password reset, to an in-depth training and understanding of the tool, whether it be online and a library of videos and trainings, to a live person who's able to evaluate that process. as a CIC, a Certified ImPACT Consultant, I recognize and appreciate the rigor that somebody has to undergo in order to achieve that certification, that it isn't just a rubber stamp for those who get it. The customer and service and training from ImPACT has been among the best. Easily accessible, whether by phone, email, having a library of resources, and more importantly, the user interface that currently exists is quite easy to utilize. Accessibility to these tests is critically important. ImPACT Passport allows a physician to access information that they might not already have. An ImPACT Passport ID with the student athlete, and then accessing baseline and or post-injury testing is valuable for the healthcare provider in order to make an assessment as to whether or not this athlete continues to have difficulty. They may not have any other tool to assess cognitive performance, and this allows them to do so. An ultimate streamlined process, of course, starts with education. Having the education for an athlete pre-injury, returning to that education after injury, as well as participating in baseline testing and post-injury testing. Anticipatory guidance, meaning knowing what to expect after a concussion, is critically important for the health of the athlete. So they know, okay, it's normal to have a mood change. Okay, it's normal to have headaches. I expected that. But having dizziness and trouble thinking in school might not always be on the top of their mind. In addition, having tools such as ImPACT for post-injury comparison, to see where they lie, as well as making recommendations for what might be needed in an academic setting, as well as in a physical setting. I would encourage an athletic trainer or other healthcare professionals to use tools such as ImPACT. Specifically, I would say make sure that you rigorously understand the tool, that you are going to properly administer the testing in a baseline or in a post-injury format, and that if you're not comfortable doing so, don't do it. If you are not comfortable interpreting, make sure that you do have somebody who is and is reliable. When it comes to other aspects of technology and concussion management, we want to make sure that we start to include the teachers as well as the school nurses as part of the ecosystem for the student athlete. We're seeing more and more importance paid to the student athlete. We want to make sure that they are returning to their learning environment before they're returning to their athletic environment. There is value of computerized cognitive testing in settings outside of athletics. And that may be in the setting of a workers' compensation case, which we see plenty of patients. We see those who've suffered from motor vehicle crashes. And you want to have a sense of where their cognitive capabilities are after an injury so that you can make educated decisions about returning to work, about returning to an activity, especially when the results or the consequences of a mistake might have a significant impact financially or to the health of their coworkers. For those occupations in which they have a higher risk of head injury, having a baseline test, once again, administered in a formal and appropriate setting, making sure that the baseline test is indeed valid, can provide great value in the event of an injury, especially in those occupations in which there is a higher rate of head injury. The Berlin Consensus pointed out a number of things that are different. For those of us who participate in taking care of individuals who suffer traumatic brain injury and concussions on a regular basis, it now is a single source for people to reference. Whereas before we would say reference this journal looking at rehabilitation, reference this journal looking at things like biomarkers, reference this journal looking at things like helmet sensors. So to start off, the Berlin Consensus was able to summarize a number of issues, including that it is more than just recognizing a concussion. It is also making sure that you are evaluating the athlete on more than one occasion. So the reevaluation process is critically important. It is not just a one-time sideline screen that you're checking on an athlete. If you've made a decision to return an athlete onto the field, you're not done. you are re-evaluating them at every opportunity. Additionally, rest. While there has been different recommendations for the duration of rest, some no rest from a long time ago, some to extreme rest very recently, the recommendation for rest between 24 to 48 hours. Sometimes it might need a little bit longer at 72 hours, but after that we actually want to get athletes back to activity. Still avoiding another injury, but getting back to some physical activity, because we know that physical activity can actually be helpful, not just for their mental health, but also for their physical health and returning to activity. Also, rehabilitation. There have been a number of studies looking at rehabilitation in severe and moderate traumatic brain injuries, and in concussion, rehabilitation can be helpful as well. We don't want to wait too long, but once the concussion has gone beyond the typical recovery period, or there's an indication that it is going to go longer, then rehabilitation that may include vestibular or balance rehabilitation, may include occupational therapy for eye movement disorders, may include a speech cognitive therapy to help with cognitive deficits after a concussion, can be very helpful. Additionally, we know that we want to make sure that our athletes are returning in a gradual fashion, and that they haven't gotten back to their full sport until they've returned to learn, until they are back at their pre-injury cognitive state, that they are in school, that they are functioning at the highest level. Also, looking at elite athletes. Once again, I have the privilege of working with professional athletes, college athletes, high school athletes, and even youth athletes, treating them with the same principles. So just because you're an elite athlete doesn't mean that you can fly through this process at a faster rate, or that we're going to ignore some aspects of concussion. The principles remain. And lastly, that we really need to be cognizant about repeat injuries and multiple injuries. That we want to make sure that their brain is not just healthy after this particular concussion, but that we are looking and considering some of the long-term ramifications. While the jury's still out on some of the research and the cause and effect of head injury and things like chronic traumatic encephalopathy, we need to make sure that we have an open discussion with our patients about that. There are various standards for post-injury impact testing. Some of the research, of course, wanted to track results over time, and so there was a relatively high frequency of post-injury testing, whether it be every 48 hours or 72 hours after injury. However, in clinical practice, it may be more beneficial to wait until the athlete has a resolution or at least a significant reduction in symptoms before post-injury testing. Now, for those who don't have a baseline, you might want to get a better sense of where they're at in terms of their cognitive performance, so that it can inform you about what academic accommodations may be needed for that particular student. Repeat baseline testing can also happen at various time intervals. For those who are injured, it is typically best until they are not only completely recovered, but you're at a time frame in which they're not engaging in any other contact activity, or specifically a collision activity, before repeating the baseline. Additionally, there are studies out there looking at multiple baseline tests to determine where their personal baseline may be. It might be that one of those baseline tests represents a great day, and another might represent a pretty bad day, as we all have variations from day to day in terms of our cognitive performance. And so doing them serially may be of benefit, whether that is once a year, twice a year. The other challenge is keeping up with the rate of development of the young brain. There may be some athletes that require more frequent baseline testing, but because the guidelines and recommendations vary, you really want to see how you can most adequately and properly do so. So we're happy to report that the Barrow Concussion Network has spread its wings beyond Arizona's borders. We are now in California, initially starting in San Francisco and working our way down the Central Coast. ImPACT has been a great partner in this program, providing a number of baseline and post-injury tests for this population. We are also working to collaborate in multiple areas throughout the state so that we can provide the highest level of care to youth athletes throughout the country. Concussion, of course, is not unique to the United States. However, the level of research that's gone into concussion is far greater than most of the world. That said, I think there's an opportunity to provide our colleagues in Europe, South America, and other parts of the world with what we've learned about concussion. And not just the things that we understand now as a proper way to manage it, but also some of the mistakes that we've made. Some of our overreaction to the injury in terms of cocoon therapy, avoiding that issue. Some of the information that we've learned in terms of risks for prolonged recovery, such as anxiety or depression. And also making sure that there is a deliberate approach to the athlete regardless of the level. When it comes to repeated concussions and the use of ImPACT, indeed there can be value in reviewing their performance, their cognitive performance after multiple injuries. However, long term, we simply don't know whether it is a computerized cognitive test such as ImPACT or even paper and pencil testing, what those multiple injuries will tell us over time. I feel that athletic trainers on the whole, if you look at the professions, including neurology, things like family practice, pediatrics, orthopedics, that athletic trainers on the whole have the broadest and best knowledge about concussion. And so they are an incredibly valuable part of the team. In fact, they are the boots on the ground keeping our kids safe. After an injury, a multidisciplinary team, especially a therapeutic team, can help to rehabilitate those who've suffered from a concussion. It's important to know, in fact, that this is an injury that can be helped. It is an injury that you don't simply have to sit back and wait to get better. There are active things that one can do to get better after a concussion, specifically physical vestibular therapy, occupational therapy, and speech cognitive therapy after a concussion. So when it comes to having a major impact on concussion, there are a number of things that can be helpful. One is education. Two, resources, including tools like ImPACT, but also policy. So having policies and rules that minimize the exposure to contact, so minimizing contact practices in, say, football, that minimize the ability for a defenseless player to get struck in the head, that can help to reduce the amount of concussion. Those are critically important to developing a program, whether it's a state program or a local program, to prevent concussions, and then to make sure on the back end they are helped and rehabilitated. That also includes other members of the team, teachers, school nurses, parents. Having them all involved in the athlete's recovery is important. Policy development for concussion is a collaborative process. And so you want to engage the key stakeholders. So for example, when we were looking at exposure to contact practices, we engaged our football coaches. We asked them, what do you think would be most helpful in reducing the amount of injury that occurs in a practice? They went back to their committee, had discussions, brought it back to the health committee, and together we were able to come up with policy that was replicated nationwide. So when it comes to programs such as the Barrow Concussion Network or the Dignity Concussion Network, indeed there is great ability to replicate. What it requires are those elements: education, policy, and resources. Making sure that the community as a whole is willing to come together for the improvement of the health of their youth in that state.